Hello, everyone. Thank you for being here. My name is Erica Wild, and today we'll be exploring the topic of self compassion, specifically for caregivers of children with complex medical needs. So, whether you're a professional caregiver or a parent, I believe this training can be beneficial to you. So, first, I'll tell you a little bit about my story. Then, we'll define and explore what self compassion is. Next, we'll talk about why it can be so hard to practice, especially as caregivers. We will look at the impact of self compassion on caregiver burnout. And finally, we'll explore ways to care for ourselves while we care for others. So, here are our training objectives. Our objectives are to understand what self compassion means, to recognize the barriers that might prevent us from being kind to ourselves, and to see how self compassion can actually protect us from burnout. So, these are all key pieces to improving our emotional well being and resilience. So this is my story. So these are my boys. This is Jackson and Colton, and they're my reason why. They remind me every day why this work matters. So every caregiver has their own Jackson and Colton. Both of my sons have a rare immune deficiency called XLA, or X-linked agammaglobulinemia, if you want the long version. It's a primary immunodeficiency that leaves them unable to produce antibodies, which just basically means that their bodies can't fight infections like other children's can. XLA is a genetic condition. It's carried on the X chromosome, which means I unknowingly passed it on to them. So I am a carrier, and I didn't know that until they were diagnosed. So the guilt that I've carried, especially as a mom, has been one of the most difficult parts of this journey. I've spent years trying to be the strongest, most capable caregiver I can be, but I will be honest with you that I have never been one to give myself much grace. I've always been really hard on myself, trying to stay on top of everything, trying to be everything that they need, and rarely stop and take care of me. So that's why this presentation matters to me so much. Because when I finally let myself take a step back and really looked at the idea of self compassion, it was very eye opening. It didn't mean I was giving up or becoming weak. It meant I was learning how to be kinder to myself in the best way possible. So, when I talk about self compassion today, I'm not coming to you as an expert. I'm coming to you as a mom who has been in the thick of it, who is still in the thick of it, and who's learning day by day that being kind to myself is not just okay, but is essential. So, the first thing I wanted to walk us through is one of my favorite self compassion exercises by Dr. Kristen Neff. So, let's take a moment and I just want you to kind of think about this. Think back to a time when a close friend was really struggling. So maybe they were feeling like a failure or just completely overwhelmed. How did you respond to them? What kind of things did you say? What kind of tone did you use? Were you gentle? Were you encouraging? How about supportive? When I think about how I would respond to a close friend who's struggling, like if they're exhausted, feeling like a failure, or just overwhelmed with life, I'm usually really gentle with them. I might say, you're doing the best you can. Don't be so hard on yourself. You've got so much on your plate. Of course you're struggling. Anybody would be. I remind them of how much they're already doing. I validate their feelings. I try and follow up with a quick text or a phone call just to let them know that they're not alone. And I say those things with warmth and encouragement. Like I really want them to believe that they are enough. So now shift that focus inward. When you feel like a failure, when you're struggling or overwhelmed, how do you talk to yourself? What kind of tone do you use then? When I'm the one feeling overwhelmed or tired or like I've dropped the ball, the voice in my head sounds a lot different. Instead of encouragement, it's criticism. Why can't you keep up? You knew this was going to be hard. Get it together. You're the reason this is happening. And the tone, it's sharp, it's cold. There's no softness, no comfort. It's like I expect myself to be superhuman. Well, I'd never expect that from anyone else. And for me, as a mom of kids with a rare medical condition, that inner dialogue can get especially intense. If I miss a detail, if something doesn't go perfectly, that voice says, You should have seen that coming. You should have done more. But the truth is, I would never talk to another parent that way. If a friend came to me feeling guilty or overwhelmed, I'd probably say something like, "You're doing the best you can in an impossible situation. You're showing up every day with so much love, and that counts for everything." So, why is it so hard to offer that same grace to ourselves? Most of us are pretty shocked when we compare the two. We tend to be so much harder on ourselves than we are on people that we care about. And this exercise is about noticing that difference and asking ourselves why that is. What fears or beliefs get in the way? Do we think being kind to ourselves makes us weak or that we don't deserve it? Now imagine how things might change if we begin responding to ourselves the way we respond to those we love most. How would your mindset shift? How might your energy change? When I think about how things might change if I started talking to myself the way I talk to people I care about most, honestly, it feels kind of like a breath of fresh air. My mindset would shift from constantly bracing for failure to allowing myself to be human. I wouldn't be walking around with this constant sense of pressure or guilt. I'd have more mental space and more emotional flexibility. Instead of asking myself, "Am I doing enough?" every single day, I might start asking, "How can I support myself through this?" And I think my energy would change too, not just physically, but emotionally. When you stop beating yourself up, you actually free up so much inner bandwidth. You're not wasting energy on shame or perfectionism. You're using it to stay grounded, to connect with others, and to be present. I'd probably feel lighter too, more resilient, and maybe I'd even start believing that I am doing okay, even on the days that feel messy. And then I think about my kids too. And if they see me being kind to myself, what does that teach them? That mistakes aren't the end of the world, that self worth isn't tied to performance, that it's okay to struggle and still be enough. That kind of shift changes everything, not just for us, but for the people we love and care for. So I know it might feel awkward at first, but self compassion is like a muscle, and the more we practice, the stronger and more natural it becomes. So let's take some time to really understand what self compassion is and what it's not, because there's a lot of misconceptions out there. So Dr. Kristen Neff, a leading researcher in this field, defines self compassion as how we relate to ourselves when we're going through pain, failure, or suffering. And the truth is, we all go through those things. So, at its core, self compassion is about treating yourself with the same warmth and care you'd offer to someone you love. It means saying, "This is hard and I'm hurting right now," and then responding to that pain with kindness and not criticism. But self compassion is more than just being gentle, it's actually made up of three key elements that work together. So, the first is kindness versus self judgment. So this is the emotional part. This is like when things go wrong, do we beat ourselves up or do we comfort ourselves? Self-compassion invites us to be caring rather than cruel to ourselves, even when we fall short. The second one is common humanity versus isolation. So this is the cognitive understanding. Often when we're struggling, we feel like we're alone, like no one else understands or is going through the same thing. But the truth is, suffering is a part of being human. Self compassion reminds us that we're not broken or isolated. We're just human and we're not alone in our pain. And the third one is mindfulness versus over identification. So, this is the attentional stance. Mindfulness helps us hold our pain with awareness without letting it take over our whole identity. It means acknowledging our feelings without exaggerating them or suppressing them. So these three key elements, kindness, common humanity, and mindfulness, form a system that supports us during our hard times. When they're working together, they help us regulate our emotions, reduce shame, and connect more deeply with ourselves and with others. Now, something else I wanted to touch on is that self compassion isn't just soft and soothing, it also has what Neff calls a fierce side. The tender side is nurturing, it comforts us and says, "You are enough." The fierce side takes action. It protects us, sets boundaries, and says, I deserve better. Both sides are essential, especially for caregivers. We need to be able to pause and comfort ourselves and advocate for ourselves, to say no when we need rest, to ask for help, to speak up. That's self compassion in action. Now, I won't read all of these, but just to point out a few, self compassionate people are more likely to feel happy and optimistic, demonstrate higher levels of emotional intelligence, show grit, motivation, and determination to meet goals, maintain healthy work life balance, and sleep well and have a strong immune system. On the other side of that, self compassionate people are less likely to experience intense shame and self loathing, have negative body image, feel lonely and isolated, become hopeless about the future, and are less likely to get colds or experience aches and pains. So now that we've talked about what self compassion is, let's talk about why it's so hard to actually practice, especially for caregivers. So, on the surface, self compassion seems simple. Be kind to yourself, right? But the reality is that many of us have deep rooted beliefs, some we may not even be fully aware of, that make it really difficult to treat ourselves with the same care and gentleness that we offer to others. There are two big categories of barriers I wanted to highlight today. First, that positive beliefs about self criticism. So, this one might sound a little strange at first. How can we have positive beliefs about something that feels so harsh? But many of us have grown up with the idea that if we're not hard on ourselves, we lose control. We believe things like, if I'm not pushing myself constantly, I'll fall behind. If I stop being critical, I get lazy. Being tough on myself is how I stay motivated to be successful. So for caregivers, this often shows up as this quiet, relentless voice that says, you can't afford to mess up. This child is depending on you. We believe that being kind to ourselves might make us complacent or careless. So we keep pushing and pushing and pushing until we break. So, second, negative beliefs about self compassion itself. Some of us are afraid that if we start treating ourselves with kindness, it'll make us lazy, undisciplined, weak, too emotional, or like we're indulging in self pity instead of taking responsibility. These are powerful messages. Many of us have internalized them from childhood, from culture, or from other workplaces. We may have learned that our value is tied to what we do and not who we are. So the idea of being kind to ourselves can feel, well, dangerous, even selfish. But here's what I want to gently challenge today. Self compassion doesn't make you less responsible, it makes you more resilient. It doesn't make you weak, it makes you strong enough to endure. It is not escape from reality, it is the fuel to carry it. The truth is that self compassion isn't about lowering the bar, it's about softening the voice that we use to coach ourselves through life. So I want you to think about this. What messages have you learned about being hard on yourself? What fears come up when you imagine being kinder to yourself? Becoming aware of these beliefs is the first step in loosening their grip. You don't have to change overnight, but you can start noticing, start questioning, and start rewriting that internal script, one self compassionate phrase at a time. These are just a few of the common myths about self compassion. While there are many more, I realized that I had internalized quite a few of them myself. So the two that stood out to me most and really challenged my thinking are the following. It is the exact same as self esteem. So people sometimes believe that self compassion means judging oneself positively and having high self esteem. Well, the truth is, high self esteem can hinge on feeling superior, causing fluctuations in self worth with successes or failures. When in contrast, self compassion promotes acceptance of flaws, leading to a more stable sense of self worth. And the second one I wanted to highlight, and the one that I find is the hardest to overcome, is that it's selfish. Most of us have been told that we should sacrifice for others, and the fear that meeting our own needs is selfish, when in reality, Caring for ourselves enables us to better support others. Self-compassionate individuals are more giving in relationships, and caregivers are more capable of helping without becoming overwhelmed. So now I want to talk about something that often gets brushed under the rug, which is caregiver burnout. If you're listening in, whether you're a parent, a grandparent, a medical provider, or someone working with children with complex medical needs, you've likely felt this at some point. That deep, grinding exhaustion that doesn't just live in your body, but in your mind, in your heart, and in your soul. The Children's Hospital of Philadelphia defines caregiver burnout as the result of ongoing physical, mental, and emotional stress. And for those of us caring for children with chronic medical conditions, it's not just a possibility, it is likely. Burnout can look like so many things. It can be feeling constantly overwhelmed, like you're always behind or never doing enough. It can be feeling angry or resentful about your situation, even when you don't want to. It's grieving the life you imagine for your child or for yourself, or being so emotionally numb that you don't even know what you feel anymore. And yet, we push through, we show up, and we fight for them. But here's the thing, you can't pour from an empty cup. You can't give your best to anyone if you're constantly running on fumes. So that's why self compassion isn't a fluffy idea or something reserved for people who have extra time and energy. It's survival. When we are compassionate with ourselves, when we speak kindly instead of critically, we interrupt the cycle of self blame and guilt that fuels burnout. Self compassion allows us to say, I'm doing the best I can. It gives us space to breathe, to acknowledge our limitations without judgment, and to be human. Research shows that self compassion is linked to lower levels of stress and anxiety, greater emotional resilience, and more effective caregiving. It's not about being selfish, it's about being sustainable. When we stop treating ourselves like machines and start treating ourselves like people, we become better caregivers, better parents, better humans. So if you're sitting here feeling worn out, maybe even a little broken, I want to tell you there is nothing wrong with you, that this is hard and it's okay to be tired. It's okay to need rest. You deserve the same compassion that you so freely give to others. So here's another exercise from Dr. Christine F. This is about something many of us are not great at, taking care of ourselves while taking care of others. And I know you might be thinking is I don't have time for self-care. I'm already so stretched thin. And that's exactly why this matters. If you're in a caregiving role, whether it's professional or personal, you are often running on limited energy. You're constantly showing up for someone else, and that's beautiful, but also incredibly depleting if we don't make space to recharge. So now most of us think of self-care as something that happens after caregiving, a bubble bath, a nap, a day off. But what happens when you can't get those things? What about when you're deep in the trenches dealing with a crisis or just surviving the day-to-day demands? This is where on-the-job self-care comes in. And it's where self-compassion becomes an incredible tool. So Dr. Kristineff, who I've been obviously referencing throughout this training, developed a simple but powerful practice called a self-compassion break. I'd like to encourage you to come back to it when you need something you can do in just 30 seconds, right wherever you are. So this practice involves 3 steps: mindfulness, which is acknowledging what you're feeling in the moment, like this is really hard right now. It involves common humanity, reminding yourself that you're not alone. Other caregivers feel this way too. I'm not the only one. And self-kindness. Offer yourself some comfort. That might sound something like, may I give myself the compassion I need right now. You can say these things silently to yourself or out loud if you feel safe. You might even place a hand over your heart or hold your own hand gently. Something small and soothing that reminds your nervous system that you are not in danger, you are not failing, and that you are human. So these kinds of tiny check-ins are what helps us stay grounded while we're still in the act of caregiving. They're realistic, they're doable, and they make a huge difference over time. So I invite you to take what you're learning today and start practicing self-compassion in the moment, not later, not when it's convenient, but right there in the middle of the hard stuff, because you deserve to feel supported too. So now that we've explored what self-compassion is, what makes it difficult, and how we can show up in small but powerful ways, let's talk about its role in preventing caregiver burnout more directly. So, caregiving, especially for children with complex medical needs, takes an enormous emotional toll and a physical one. It's more than a job, it's 24/7 emotional labor. So, let's look at the emotional side first. Caregivers often experience stress and anxiety from managing appointments, medications, and the unpredictability. They often experience guilt and self blame when outcomes aren't perfect, even when they're out of our control. Loneliness and isolation, especially when friends or family don't fully understand what we're going through. And for many, depression, especially when it feels like there is no end in sight. Then there's the physical toll, stuff like chronic exhaustion, disrupted sleep, and even health conditions that can develop from long term stress. This is why self compassion isn't just a nice idea, it's a protective factor, a buffer that helps shield us from these effects. Self compassion reduces that harsh inner voice that says, I should be doing more, or I'm not doing this right. It helps us respond to challenges with kindness and emotional balance. And when we make self care part of our mindset and not just a checklist, we become more resilient in the long run. It also helps normalize imperfection because, let's be honest, perfection doesn't exist in caregiving. There are good days, hard days, and everything in between. Self compassion says, you don't have to do this perfectly to be doing it well. So, and something we don't talk about enough is how self compassion helps us feel more connected to others. When we stop judging ourselves, we become more open to support. We reach out, we allow help, and that's powerful. And finally, it helps protect our physical health. Studies show that people who regularly practice self compassion have lower levels of inflammation, improved immune function, and better sleep. It literally helps the body heal. So, if you've ever wondered, will being kind to myself really make a difference? The answer is yes, in more ways than one. So, we've covered a lot today. So, I wanted to slow down, offer a few clear takeaways to hold on to, especially when life gets busy again. First is remember this self compassion is not weakness, it is a source of strength. It means treating yourself with the same kindness you would offer to a friend, especially during the hard times. That includes acknowledging that you're hurting, recognizing that struggle is a shared human experience, responding with care rather than criticism. It's okay to give yourself a break, and in fact, it's necessary. Many caregivers, including myself, believe that being hard on ourselves keeps us going, but over time, it wears us down. And what it actually sustains us is the ability to rest, to ask for help, and to speak to ourselves with grace. Self compassion helps. It reduces burnout by lowering stress and emotional exhaustion, promotes self care by giving us permission to take breaks and seek support, and it builds emotional resilience so we can keep going even when it's hard. When we practice self compassion, we model it for those around us, especially our children, and that's one of the most powerful gifts that we can offer. But I wanted to leave you with this thought. You don't have to be perfect to be a good caregiver. You just have to be present and kind to yourself too. So thank you so much for showing up today. I hope you walk away with something that brings a little more gentleness into your life. Here are some of the sources and the readings I've used in preparing this presentation. If you're interested in diving deeper to any of these topics, these are a great place to start.